While we're waiting, if you all wouldn't mind to add pronouns to your names, that would be great. Thanks, everybody. So to respect everybody's time, I think we'll go ahead and start, and we'll just let folks in as they arrive. If they come late, I know there's always a couple people who expected to come and something comes up. Thank you for being with us today. For those of you who were here with us last week, so sorry for the Zoom bomb. We've gained some people that weren't here last week. We've lost some people who were here last week, but it'll all work out in the end. So we're going to ask if you can to keep your cameras on as much as possible, because in other circumstances, we would all be in the same room together, and it helps us to get visual feedback as well as sound feedback and written feedback. And take care of yourselves. If you need to turn off your camera, if you need to leave the room, if you need to go to the bathroom, whatever, we're all adults, do what you need to do. And remember that you're always welcome to pass if you are not able or do not want to participate in any exercise. Jessie, do you want to start with intros?
Yeah, so I'll go first, and then we'll call on people and go around the whole room. And we're looking for your name, pronouns, your organization, and the role that you play in that organization. So I'm Jessie Berkland, and I've been on the leadership team of RISE since 2017. And I'm also an abortion doula with the Mountain Access Brigade. And I'm in grad school at ETSU in the criminology program as well. Cindy?
I'm Cindy Huss. I'm the managing director of RISE Healthy for Life. And I co-founded the organization with Sarah White in 2017. Jessie's been with us almost so close to the very beginning. And that is me.
All right. Becky?
Good morning. This is my first time to join. I got an invite, I think, because with Judy McCook, I'm going to be working to develop training for police. I'm a national speaker, trainer, consultant, and author on the subject of trauma-informed care, and a member of the ETSU Ballad Health Strong Brain Institute.
Awesome, thank you. Megan? Oh, there's two, I'm sorry.
Oh.
Megan Quinn.
Sorry, Megan Parks, I didn't even see you were here. Megan Quinn, I'm faculty in the Department of Biostatistics and Epidemiology at ETSU. I was also invited by Judy McCook, like Becky, and I'm also a member of the Strong Brain Institute at ETSU, and do research on ACEs and trauma-informed care and kind of how that affects your sexual health and sexual risk behaviors. So,
great.
Glad to be here.
Maggie?
Hey everyone, I'm Maggie Wood. I'm with A Step Ahead Foundation Tri-Cities. We're a local nonprofit. We work to help prevent unintended pregnancy by removing barriers to long-acting reversible contraceptives. And yeah, I'm super excited to be here. Thanks for inviting me, Cindy.
Hey, you just were late to go here.
Hey there, I'm Kelsey Wallace. I am a nurse practitioner and a sexual assault nurse examiner. I am on Judy McCook's team with the Help Sarah grant, so I'm excited to be here.
Thank you. Laura?
Good morning. My name is Laura Roller. I'm a victim advocate with the program YW Cares. We are of course, victim advocacy program through the YWCA in Bristol, and we work with young adults between the ages of 17 and 24 who's ever experienced any type of crime victimization, so domestic violence, sexual assault, previous child abuse, really anything. I'm really glad to be here.
Thank you so much. Megan Parks now.
Good morning, everyone. I'm Megan Parks, and I'm the program coordinator for the YW Cares program that Laura just described. I basically just oversee the day-to-day operations, and then we also operate 24/7. So we are your hospital responders for victim advocacy for child sexual assault right now, and looking at some adult sexual assault in potentially Virginia. So excited to be here, and thank you for inviting us.
Thank you. Brianna?
Good morning, everyone. I'm Brianna Berry. I'm from She Her, and I'm the co-executive director of Healthy and Free Tennessee, and we're a statewide reproductive freedom advocacy organization.
Thank you. And Amelia?
Hi, I'm Amelia Sforson. I have she, her pronouns. I am a victim advocate with the YW Cares program as well. So we've got 3 of us here. Our whole team is here. So thank you for having us.
That's great. Thank you. And Jillian?
Hey everyone, this is Jillian Reese. I'm the director of Carter County Drug Prevention in Elizabethton. I'll kind of be on and off camera today. I'm driving around and doing all the things that I didn't have planned last Thursday, but I do have planned today. And so I'm excited to be here. We at Carter County Drug Prevention are got to work with RISE and become trained in our whole lives, sexuality education, and also we just really love talking about sexuality education and trauma and the way those things kind of can tie together. So I'm excited to be here and part of this.
Thank you.
Okay, so I have our meeting agenda, which I'll share real quick. Let that go away. There we go. Okay, so we've done our welcome and introductions. We're going to do a brief intro to collective impact, so we're kind of all on the same page. And I know that a couple people have to leave early because they have a Strong Brains Institute meeting. So whenever you need to leave, that's fine. But we will be having 2 breakout rooms, the results of which will help us move forward in our next meeting. And just so that you know, our next meeting, I'm going to put the registration link into the chat now, and I'll put it in again later so that those who have to leave have it now. Sorry. Trying to do too many things at once. Okay. All right. Just so that we're all on the same page about collective impact. Collective impact, when I first heard about it, I thought, wow, that's a really great idea. And I kind of thought about it as like collaboration on steroids. And I went to a conference in September and found out it is so much broader and deeper than that. So what I was kind of thinking about collaboration would be like maybe RISE, which provides and promotes comprehensive sex ed, and A Step Ahead Tri-Cities, which makes long-acting reversible contraception more accessible, and like the Community Coalition Against Human Trafficking, all have programs, and organizations that would be interested in a program from one would be interested in programs for another. And so we would cross market and support each other and maybe do some co-programming. And that's collaboration. That's not this. So just so that we know that it's not that. About halfway through the conference I attended in September, one of the facilitators said, you cannot solve systems problems with programming. And that for me is when it really clicked. You can't solve systems problems with programming. So it was, that moment was inspiring and it was uplifting and it was terrifying because it's much bigger than strict collaboration. So collective impact is not only working together to amplify what already exists, it's looking at a problem and breaking it down to the basics and looking at building the systems anew in a better, more constituent-centered, trauma-informed way. So it's seeking to change the basic systems that sometimes cause but frequently exacerbate problems that we recognize in the work that we do every day. So it has incredible potential as long as the organizations involved take time to build trust and maintain focus on the core constituents and communicate really effectively. So, Jessie?
So the collective impact involves learning from community members, cross-sector partners, and data. So we would develop a common agenda and define our focus and create a shared vision to solve it. Then we'll brainstorm new ways to approach old issues and coordinate our efforts through mutually reinforcing activities to maximize our end results. We hope to establish and gather shared measurements to track our progress and allow for continuous improvement. And this is a lot for one organization to do alone. And I know that it seems a little overwhelming even for a traditional group. But weaving this collective impact web will give us a platform to be able to exchange ideas and experiences, resources, and data. And it'll benefit our community in ways that we can't do on our own.
So, and the nice thing is we don't have to invent the wheel. There is a framework available, resources already exist. And here's an example of what they recommend for collective impact structure. So you can see here, this would be the entire collective impact organization. The backbone organization is not the boss. The backbone organization, like our backbone, supports the whole effort. So whoever ends up being the backbone organization manages data collection, manages communication, just basically keeps the work of the organization going forward and is the connective hub. These little spin wheels here represent various working groups, and each working group has a focus, and organizations that are either affected by it or affect the focus would work together in a working group. There might be, an organization might be involved in more than one working group at a time. And of course, whether that's possible depends a lot on the size and resources of the organization. We will definitely have more than one focus or working group going at a time eventually, but at the beginning, we may start small and only have one or two going.
Cindy, can you share your screen?
Oh, sorry. I thought I was. Let me try that again. Okay, sorry about that. Okay, backbone organization supports the whole organization. These are the working groups. There can be multiple working groups and probably will be multiple working groups going at the same time. And then there's a steering committee, which often is made up of individuals from either the organizations involved who have resources to have a person on the steering committee. It might also involve constituents. So it can just be community members who are women, who are survivors, who are LGBTQ, who have children, you know, a variety of things. Folks in nursing facilities who are seeking sexual equity, those sorts of things. So this is an organization of organizations, but it is also an organization that is supposed to listen to input from constituents and invite and make accessible the work so that constituents can join us and help be part of the solutions that will serve them. Does anyone have a question about the basic structure? Okay. Again, in the chat, this organization's website, Collective Impact Forum, has loads of great resources. They have articles, they have papers, they have webinars, they have podcasts. So if you're interested, there are loads of resources here. Okay, Jess?
So probably the most important part of all of this is building the relationships and trust and being able to communicate effectively. So I know that a lot of us have worked on stuff together before, so we have a little bit of a head start, but this work is going to require us to be really vulnerable and to question assumptions and to sometimes admit when we're wrong. So it's important that we create an environment where we each feel safe and supported, and when we can share our ideas and concerns. And so discomfort and conflict are inevitable and necessary to spark the kind of systematic changes that we aspire to. So leaning into that discomfort and building these relationships is going to be really necessary to work through the conflicts the best ways so we can find our flow to make these big waves.
Okay, so that's really quick and dirty. Does anybody have any questions at this point about generally what collective impact is or does or how it works? No, we're good. Jess and I are that awesome. Okay, so you want to tell them about the first breakout room, Jessie?
So we're going to be identifying broken systems. So right now, the working goal of this initiative is enhancing health, safety, and quality of life regarding relationships, sex, and sexuality. So creating a formal shared agenda is some of the work that's ahead of us. And we'll use this draft agenda today as a reference point for the breakout session. So we're gonna, how many groups are we gonna do, Cindy?
I think just 2.
Okay. So we're gonna ask each group to elect one person to take notes. And do you have that document handy?
Yes. Let me grab it and I'll drop it in.
So we have a Google Doc where you can take notes. And then, so we're going to be brainstorming. We ask that you resist the urge to critique suggestions and just capture them all, whether you agree with them or not. And so based on the shared agenda, who are our constituents? So you can think specifically who you work with right now, or just anyone, like just brainstorm. And then we're going to think about what do they really need? What do they actually get to enhance their health, safety, and quality of life regarding relationships, sex, and sexuality? And related to the shared agenda, what is it that we need to address to bridge that gap in a constituent-centered way? Do we have this written out somewhere, Cindy?
Yeah, I just posted it.
Oh, okay, cool.
And then, so we're gonna, Jessie and I will each go in to the breakout rooms to check in on you. So if you have any questions, if you get stuck, if you're unsure of the direction, we'll check in. Okay, so here we go. Oh, wait, sorry, here we don't go.
Does anyone have any questions before we go? Now we'll ask someone from each group to share a couple of the types of constituents, what they need and get, and their ideas for what's needed to fill in the gaps. And just share things that you thought were surprising, or maybe you gained a different perspective on, or any other insights at all. Do we want just one person from each group, or do you want a little bit from everybody?
Well, maybe we can start with whoever took notes because they've captured and have access, immediate access. So group one, you want to go first? Is that Maggie, I think?
Yes, I was just checking to see if we were group one or group two. I couldn't remember. Okay, so we talked about all the different constituents that our individual organizations were serving. So for YW Cares, victims of crime within our area, children, especially after hours, young adults, and anyone who's a victim of abuse or violence, including children. At a step ahead, we will serve anyone who would like to prevent an unintended pregnancy who's in our 8-county region. But we specifically do education to target any groups that are reporting a higher than average rate of unintended pregnancy. So for us, that's teens and anyone struggling with substance use disorder. Hey, sweetheart, that's lovely, but I'm just talking real quick, okay? Thank you. And then Becky's working with a really amazing Handle with Care program that was developed here that's now providing police training, trauma-informed police training to reduce trauma on scene in justice situations. And she's working on that nationally. So some overlap with constituents and some not, but all pretty much linked together. What do our constituents need? More sexual education, healthy relationships education that would really serve to prevent a lot of abuse and assault, as well as prevent unintended pregnancy. Mental health education. We talked about how there are children growing up in homes where there's household dysfunction, parents weren't parented, and then young people gravitating toward those same relationships, those same systems that they themselves recognize, thus perpetuating the cycle of trauma and abuse. So working toward an education that's accessible to everyone that would help break those cycles. Becky shared about a UT extension program about not being in a relationship with a jerk, and that the CDC talks a lot about preventative factors, being one of them being healthy relationships. So education across the board is something that was discussed. What do they already receive? Abstinence only until marriage education or no education, very little communication about healthy relationships, mostly just broad comments, not actual helpful advice with resources, plans, and specifics. And we talked about how they receive that education later, sometimes even college, sometimes even post-college. What gaps do we identify with that? Starting earlier, starting elementary education with body safety, bullying, what is a healthy friendship, consent, how to report, it's okay to report, comprehensive evidence-based reproductive health education, with professionals being trained as well, knowing how to handle questions, reports, etc. appropriately. Why trauma-informed multidisciplinary teams need to be best practice, incorporating everyone into the conversation, and that another big barrier is not knowing how they're going to be received or treated. If you do report, will you be accused of false reporting and not met with empathy? And that's as far as we got.
Good job, Maggie.
Thanks.
That was a lot.
Yeah, that was really awesome. Thank you so much.
Okay, Kelsey.
I know. I'm like, oh gosh, that's a lot. Okay. So when we were talking about who our constituents are, we kind of went really broad. We didn't break it down organizationally. We were just kind of talking as a group. So we were saying anyone in the community. Initially, maybe there was more of a focus on women, more so than men, or people that identify as female. Anyone who is of age to be in a relationship or have sexual or reproductive health needs. We had people present that work with advocacy, with child sexual abuse and things like that. So that's kind of a different, broader conversation about consent, and maybe not even knowing what sex is, but understanding what consent is and that they are allowed to say no. We were thinking about maybe breaking focuses into different age groups, like kind of our constituent is everyone, a really broad definition. Megan gave a great one, and I think I'm missing potentially a verb and some adjectives here, but it said any individual who would benefit from, oh shoot, hold on, sorry, blocking up on me. any individual who benefit from enhancing their health, safety, quality of life regarding sex, sexuality who lives in our region. And then we were kind of circling back to this conversation because there was a member of our group who was coming from more of the central and west Tennessee, where I think initially our group was more focused on the eastern Tennessee, Appalachia region. So that was a good conversation, how different, depending on where you are, your constituents and their needs are going to be really different. I know Brianna was talking about they're doing a lot of great work on the policy side and legislatively pushing different things specifically related to pregnancy and incarceration. So that's a really specific population that doesn't have the same needs as, say, somebody on a college campus. So that was a great point. As far as what do they need, Jillian was mentioning that she works with youth and there's a real problem with support. She said she couldn't say that enough. A lot of problem with support, specifically for those who are identifying outside of gender norms, access to resources. Even within the city population, there are scarce resources, but when we get into the rural populations, it's even more of an issue. And Amelia spoke about how things have transitioned to Zoom, but maybe some of these clients, wherever they are, we were talking more about rural, I think, but maybe they don't have access to the technology. And even if they do, maybe they don't have the literacy, the tech literacy to effectively use the technology that they have. So maybe they may be really good with social media, but they don't understand how to use Zoom as a platform or take online classes. So that was kind of as far as we got in our group.
That's great. Thank you.
So I'm looking at time. So the next breakout room is centering equity in our work. And so I'd love it if, I think Becky and Amelia, you guys are the ones who have to leave. Is that correct? Oh, Becky and Megan. Okay. So I would love it if you are able to participate for a little bit, if you feel comfortable to do that time-wise. Is that okay?
Yeah, that's fine with me.
Okay. Yeah. Okay. Awesome. So one of the keys to success and collective impact is centering equity, both within the initiative and in the community through the work that we do. So each breakout room is going to take a question and brainstorm some ideas. And again, it's brainstorming, so don't critique, just gather thoughts. So in the previous questions, we asked what constituents really need and what they actually get. So we're going to think about constituents and who decides what they need, who determines what they get, and who should decide and interpret those things. How do we make that happen? And within the initiative, there might be a constituent who participates to share an important perspective and a large organization that participates because this is a small part of the work that they do. So how do we ensure that we continue to hear all voices and that everyone who contributes to this important work has a part in developing constituent-centered solutions? So I'm gonna, let me copy those questions real quick. And I'm gonna put those in the chat. Again, we'll need somebody to take notes in the same document.
And you might have to request access to it if you haven't already, right?
Right, yeah. Okay, so this time you'll have to pay attention to which breakout room you're in, because breakout room 1 is going to handle the first question and breakout room 2 is going to handle the second question. Just saying, and I got cut off, I apologize, that when different organizations that are working in collective impact interact with other organizations, and when we start changing the way that we do things, hopefully that will develop critical mass. It will create discussions, and hopefully more organizations will join, and then we'll be able to take those changes into further into the community. So, okay, so do we want to do a quick debrief? Group 1, who's debriefing that one?
I can take it. I can take over. Maggie had to go, but so as far as actually most of our group had to go, but as far as who decides what they need, Becky was talking about when she wrote the grant for the Family Justice Center model, that it's really outstanding because it's driven by the need of the person. So the individual tells the story one time, and then a navigator helps them navigate a safety plan or their legal options without judgment, and that it's driven by the need of the person. YW Cares partners with Branch House, which is a family justice center, to try to let the client drive what they want. Sometimes the barriers to that, the criminal justice and medical system, take some of the control away from the client. We want to be always client focused and client driven. One of the barriers that Maggie was talking about was that the education that is made available to teens in high schools is determined by the state. So that can be a limitation. Policy at, so kind of what I was talking about is the policy at different levels. So we may have good policies in place, but how do we ensure that those policies are carried out? You know, right now with Dr. McCook's grant, we have this great kind of ability to address this for different educational needs, but that's not really a regulatory oversight type thing, right? That's just if we hear about it. So once the grant's not available, what are the mechanisms that are in place to protect survivors and make sure that all of the things that are baked into policy, either at a local level or a state level, are actually happening? So that was what I had to refer to that. So, and then as far as advocating, so just talking about advocating for policy change, what are the checks and balances to make sure those policies are taking place? And there needs to be additional players at the table. If you don't have the buy-in of valid, somebody from the local police, we can want to have changes, but when we hand it off, if those players aren't at the table, then there's nobody to implement it.
Excellent. Thanks so much. And then group 2.
Hey, I can do ours. And I will say we answered the question, who decides what they receive and who interprets that? Was that what we were supposed to do?
I think it's okay. We initially had more questions, so I think it's okay, whichever question you answer.
Okay, great. So we answered basically who decides what people receive and who we feel should decide and interpret the information. So we said for who decides information right now, we would love to say that our constituents make the decisions for what they receive. And I know within certain organizations that is truthful, where we want their feedback, and that's what we try to provide to the best of our ability. Unfortunately, that may not be the case for most places. You know, a lot of places are grant funded. They work for the organization, they work for the state or the federal government or whatever it may be. And unfortunately, that's kind of where a problem lies, where you know, the clients know what's best for them and what their needs are, but unfortunately may not make it all the way up to the very top tier where decisions are being made for policy and funding purposes. So we're seeing that issue. And we also just talked about the frontline staff really need to be able to have input in what we're seeing and what our constituents are saying. You know, we complete surveys with everyone we work with, and it would just be very easy for frontline staff who are working face-to-face with people to make reports all the way up and say, this is what we're seeing, these are the needs that we're seeing, you know, how can we try to, you know, make that happen for the people that we serve. That would just be more kind of a streamlined information that may be helpful. And a lot of our constituents, they don't really know what all services they can receive because they don't know the services, they don't know the program, they don't know the funding, they don't know what to ask for. So to be able to give them that type of voice would be really helpful. That's kind of what we discussed.
So Megan, what are you guys able to do with the feedback that you gather from constituents? Well, is it mostly just for improvement within the organization?
I think it can really be used for multiple purposes. So I do think it should be used to improve your current services, right? I think we should use that. But then if there are any type of restrictions, you know, higher up from your funding source or from the state or whatever governing body you have, I think take those concerns all the way up to those who are making those large decisions. Hey, you can spend money on this, and I don't think people really need this, so we're not going to focus on that. I think if there there are deficits there, you can go to the governing body and say, we've completed, say, these surveys. This is what the response was. Can we make these improvements? Because this is what we need. And be able to speak and basically advocate for the people. Ideally.
Thank you.
So if that helps answer your questions.
Yes, it does. And I'm really excited to look at the documents. After this, I'll be sending out, we're gonna edit out the 15 minutes of dead time while you guys were in breakout rooms, because breakout rooms don't get recorded, but the meeting room does. And it's just Jesse and me hanging out in there. As soon as I do that, I will send out the recording, a link to the recording and the cleaned up document, as well as the link for the next meeting registration. It's going to be, we're hoping, and we think we found a sweet spot, that on second Thursdays from 9:30 to 11:30 is going to be when the meetings happen, because there's a health council meeting from 12 to 2, and that gives a little half-hour break in between for people who need to. So I hope that second Tuesdays work for a lot of folks. We had a really good attendance last week, so we're hoping that that will work. So I did put the meeting registration in the chat. It's right up at the top. And you can register as early as you want. I am requiring approval of registrations. So if you register at the very, very last minute, it will be harder for me to notice and approve you. So don't wait until the last minute. Okay, so go ahead and unmute. Does anybody have any other questions? Any specifics that you would like to talk about in an upcoming meeting? Any feedback on this meeting?
I don't think I have any feedback. I think it's really interesting to hear the perspectives from other people who work in different agencies and just different programs. I think it's really enlightening to learn, what other people see and what they're doing.
Yeah, I agree. Anybody else?
I really appreciated it. It was I'm excited about this, and if only, if I never went to another meeting, which I will, I'm so grateful to have connected with the different organizations I had no idea that were out there. So it's been very, very helpful.
Yeah. Okay.
I'm excited when this one's not just like thrown together, like we rescheduled from last week, and like we have a real full one next time. And like,
Laura or Amelia?
I just wanted to say thank you for getting us all together. And I think this is great. I learned a lot. So thank you so much.
I agree. It's nice to have everyone at the same table.
Cool. I will also be sending out this survey. Yeah, I know, table. I will also be sending out the survey link in the follow-up email, but it's here also. So if you want to go ahead and do it now, since we're ending a little early, yay us. That will allow us to make improvements for following times. And also if something that's not in there, but feel free to email me. If there's any other organization that you would like to be invited, give me a contact and I will send invitations to them as well. Because we know lots of organizations, but we don't know all the organizations. All right. Well, thank you so much, y'all. I appreciate you. And hopefully we'll see you next month.
Thank you.